Good morning, everyone, and welcome. I'd like to acknowledge that we are gathered on the unceded and ancestral territory of the Mi'kmaq people who have lived on and cared for these lands for thousands of years. We are grateful for their stewardship, past, present, and future. For those that don't know, my name is Kyle McDonald, and I have the esteemed honor of being the chair of the IWK Foundation Board of Trustees. I want to extend a very special welcome to some important guests. Claudia Chender, leader of the NDP, our friends from Women's Health Collective Canada, the Nova Scotia Menopause Society, the Halifax Tides, Organon, Hologic, Shoppers, and Deloitte. And a special mention to all the Health Centre team members. Thank you for supporting us here today. And of course, a very special thank you to the staff at the IWK Foundation who work tirelessly day in and day out to put this together. My job today is simple. It's to thank all of you for being here. Your presence means the world to the women who shared their stories and to all of us at the Foundation. Today really is a historic day. An overwhelming number of women across Nova Scotia, New Brunswick, and Prince Edward Island came forward to share their health stories openly, courageously, and in numbers we've never seen before, and frankly might not have expected. We're here today to honor those voices, to share the findings, and to take a crucial step in building the momentum for women's health that this region and this country urgently needs. On behalf of the board, I want to say how proud we are to see the IWK Foundation stepping forward to champion this conversation. We do believe that this is a defining moment, not just for the Foundation, but for women across the Maritimes. I speak for the entire board when I say we are so proud that the Foundation is playing a leadership role, amplifying women's voices and pushing for meaningful change. Now, I'd like to introduce our speakers for today. Someone who probably needs no introduction to the people in this room, Jennifer Gillivan, President and CEO of the IWK Foundation, Elizabeth McRae, Vice President and Research Lead at Crestview Strategy, and Heather Crichton, Vice President, Brand Strategy and Marketing for the IWK Foundation. Now, please join me in welcoming Jennifer Gillivan to the mic to kick things off.
Thanks, Kyle.
Thanks, Jen.
Welcome, everyone. It's fitting that we're having this conversation today as we approach the International Day of the Girl on October 11th and World Menopause Day on October 18th. When we launched this survey, we hoped a couple of thousand women might respond, and I'll be honest, it was July, I was dubious. Instead, 27,317 women across Nova Scotia, New Brunswick, and Prince Edward Island took the time to share their stories. It's a record. That response was extraordinary, and it tells us something important. Women are ready to be heard. The results we're sharing today are more than statistics. They represent a powerful collective voice calling for meaningful change. Today is about maritime women. The time will soon come to talk about solutions, but today, as I look in the camera, it's about every single one of those 27,000 women who've answered the call on this survey. Now I'd like to speak directly to those who took the time to complete the survey. The following is an open letter to 27,317 women, which we will be publishing. Dear women of the Maritimes, in June, we asked you to tell us the truth about your health. We expected stories. We received a movement. 27,317 of you across Nova Scotia, New Brunswick, and Prince Edward Island responded to our survey on women's health, making it the largest of its kind in our region's history. But you didn't just check boxes, you told the truth. Thousands of you wrote, in your own words, what it feels like to carry the load you do, to care for others while struggling to care for yourself, to manage chronic health concerns while feeling invisible in the very systems that are meant to support you, to show up every day despite being overwhelmed, dismissed, tired, and unheard. More than 13,000 of you shared raw, unfiltered, and courageous personal stories. Stories of stress and anxiety, perimenopause, menopause, pain, delayed diagnosis, mental health struggles, caregiving burnout, and the silent weight of being the one who holds everything together when it feels like no one is holding you. Let me be very clear. We see you. We hear you. And you are not alone anymore. What you told us is that women in the Maritimes are just not thriving. Many are just getting by. More than 75% of you said you've delayed or avoided seeking care because of time constraints, fear of dismissal, or past negative experiences. You told us that your health issues are not just affecting your body, they're affecting your sleep, your self-esteem, your family, your work, your relationships, and your future. These are signs of a system that hasn't caught up to what women actually need. And while, yes, some of what you shared reflects broader issues women face globally, there's something powerfully local in your stories, your experiences that are shaped by our geography, our gaps in care, our rural realities, and the maritime culture of just keep going. But we can't just keep going, not like this. Many of you told us you feel like you've had to piece together your own care, rely on social media for basic health information, or wait years for help that may never come. You spoke about chronic pain, weight, anxiety, and stress, not as isolated issues, but as a constant companion. You told us what it means to be the one that people depend on while quietly wondering, when will someone ask how I am, how you are? You are the experts on your own health, and now it's time for systemic change. This is not a call for women to be more resilient. You've already proven your strength over and over again. What's needed now is something bigger, a reimagined approach to women's health, one that listens, adapts, respects, and responds. At the IWK Foundation, we are committed to being a champion for this movement. We know that clinical care is just one part of the picture. Your health is shaped by your financial well-being, your caregiving responsibilities, your mental load, and the stories you've been told or not told about what's normal. We also know that change takes all of us, and that change starts with raising your voices even louder. That's why we've publicly released the Voice of Maritime Women, the unspoken burden of women's health, and created a social media toolkit to help you share the findings, advocate for change, and remind others they are not alone. It is no longer unspoken, it is undeniable. To every woman who filled out the survey, a heartfelt thank you. Thank you for your honesty, your courage, your time, and your trust. And this is just the beginning. There's more to come. You deserve care that sees you as a whole person. You deserve systems that don't wait for a crisis to take you seriously. And you deserve a future where women's health is not an afterthought, but a priority. And we're with you every step of the way. If not now, when? And if not us, who? With the deepest respect together in health equity. That will be published after today. So I'd now like to, thank you. I'm emotional about it. Thank you. I'd like to invite Heather Creedon, our VP of Brand Strategy and Marketing, to join me at the other podium as we review the results. Heather has truly shepherded this project from the very beginning with me, working closely with her team to bring it to life. We're so grateful for her leadership and her dedication of the team members who helped make it possible, and specifically I'd be remiss if I didn't single out, I don't know where she is, she's working somewhere, Nicole over there, who has been just phenomenal to help us get to this point, so thank you, Nicole. We're also fortunate to have Elizabeth McCrae with us here, Vice President Research Lead at Crestview Strategy. Elizabeth led this research with her team and brought not only deep expertise in research, but also a real commitment to ensuring women's voices were heard and respected throughout this process. Thank you, Elizabeth, for all your work. As you can see, We had an overwhelming response, 27,317 women. Most were from Nova Scotia, with 24% coming from New Brunswick and 8% from Prince Edward Island. What is a true daily reality of women's health in the Maritimes? So what is that? The survey uncovers the pervasive health challenges and deepest concerns of women, outlining a landscape where average is the norm and many struggle to remain unspoken.
As a baseline question, the first thing asked of the women was to share their physical and mental health ratings. Both categories are 6 out of 10, with room for improvement. This provides us a baseline which we can measure against in the future.
The overall sentiment regarding personal health is one of management and endurance rather than vitality and excellence. Women describe doing their best to stay afloat, managing symptoms, navigating wait times, piecing together care where they can. Their health is something to be managed, not celebrated. The sense that good enough has become the goal speaks to the quiet resignation within a system that should be helping them thrive. Women are holding everything together, but few feel supported.
When considering their own health journey, only 34% of maritime women respondents are doing okay, which means they are good or great. This small group of women reported feeling truly healthy and needed little or no extra support. 27% of women are actively seeking medical care or in the process of receiving care. This is a group that is in need of information and support. 1 in 5 women reported they are currently in crisis. They are feeling underserved. Women's health knowledge is highly concentrated on the present, which creates a significant confidence gap when they look to the future. Currently, half of women are not informed about their next stage of life.
An overwhelming majority of women have actively delayed or avoided seeking health care. They actively delay and avoid seeking health care for their concerns. Let that sink in. That is 3 out of 4 women are making the decision to delay health care for themselves.
Women describe a quiet conflict when engaging with the healthcare system. The tension between wanting to be heard and fearing they won't be believed. Many said they edit themselves before appointments even begin, deciding which symptoms are worth mentioning and which to leave out. It's a learned survival skill in a system that has taught them not to expect much.
More than half of women are in charge of the healthcare decisions for their entire households, and as we have learned, leave themselves to last. For most, this isn't a shared or delegated task. It's a core responsibility. It's clear women are carrying the burden of the mental and logistical load of coordinating care for everyone around them. It's an invisible layer of stress, one that takes time and energy and often comes at the cost of their own well-being.
56% of women say they're living with health issues that disrupt their daily lives. For these women, health isn't a background concern, it's something they actively manage every day. It affects their ability to move through life with ease.
The impact isn't isolated, it's a domino effect, starting deep within and rippling outward into every part of their lives, their sleep, their mood and emotional well-being, their self-esteem, and even their self-worth. These are the key components that make them who they are as people.
Of those who are having health issues, 8 in 10 women are experiencing health impacts at home.
The impacts are broad. At home, women are having difficulty concentrating or focusing. Their health issues are impacting more than themselves. For half, it's impacting their entire family. They're missing important elements of their lives by avoiding social interactions and having difficulties in their sex lives.
Again, of those who are having health issues, 70% are experiencing work-life impacts.
The economic impact is most alarming. With 2 out of 3 women missing work or having decreased productivity. These women are avoiding social interactions at work, and 39% of them are having difficulty even maintaining employment. That's a staggering number. When women were asked who they see as a champion for their health, most pointed to the people on the front lines, their doctors, nurses, and pharmacists. But for more than a quarter of women, when asked who their champion was, the answer was no one. 31% of respondents couldn't name a single person, organization, or leader who they feel is truly standing up for their health. That absence matters. It means too many women feel like they're navigating their health alone. And hopefully from today, they'll know they're not alone anymore. The message from women is clear and nearly unanimous. The system as it stands today is not meeting their needs. 70% is not a small gap. We have to really hear these women, and that's what today is about. It isn't about tweaking what already exists. It's about rethinking the very system itself. Because healthcare doesn't start or stop at the hospital door. It extends into workplaces, schools, and homes. Women are calling for real change, not just better appointments, but a better approach. One that sees their health in the full context of their lives and meets them where they are. Women were clear about what needs to be prioritized. They told us exactly where the gaps are and what matters most to them. By putting these issues at the top of their list, women across the Maritimes are saying loud and clear that these are not niche concerns or private struggles. They are major health issues that have gone unaddressed for far too long.
Starting with the top priority, menopause, hormonal health, and perimenopause. Second priority tackles stress, anxiety, and depression, which takes us to the third priority, obesity and weight management. Priority 4 focuses on sleep disorders. And lastly, the more serious issues facing maritime women, heart disease and cancer. While there is a vast list of others, the women told us these were their priorities.
Women have demonstrated resilience. What they need now is a system that listens to them. Despite this, our report captures a deep well of resourcefulness and clarity about what must change. When asked, women want more access to doctors. They want dedicated women's health clinics. They want stronger education and training for doctors and medical professionals on women's health. They want research into women's bodies, symptoms, and experiences. They want support for mental health and caregiving. And lastly, they want care that listens, respects, and includes women in their decision-making. They no longer want to be dismissed. The findings are clear. Meaningful change is not optional, it's urgent. This report offers more than just data, but direction from those who matter, the women themselves. Women need to believe they were never the problem. This is a roadmap for decision makers, health leaders, researchers, and advocates ready to build a system where women's health is no longer an afterthought, but an actual priority. Women across the Maritimes are already doing the work, researching, advocating, caregiving, enduring. What they need now is not encouragement to keep going, it's commitment from healthcare systems, institutions, and leaders to meet them halfway. They're just looking for a fair shake. This is not a story of what women lack. It's a story of what they deserve.
Thank you. Good morning, everyone. I'm Robin McIsaac, owner of Infuse PR. I'm thrilled to be supporting this group of amazing women and this amazing organization. This time I'd like to open the floor for questions, starting with media. I know Ella and Stephanie are both here. I just don't know where they are. Ella's in the back there. We're just going to ask you to use the mic so that we can get your voice throughout the room.
Okay, here, I'll take this. Oh, I'll keep this on, actually. Can you hear me through this?
Yep.
Yeah.
Okay. 86% of women say there has to be significant changes. Obviously, these are really overwhelming results. What changes need to come first, and how will those get off the ground in the next few months?
So I think it's not one entity, ourselves included, the IWK Foundation, can answer that one question. It's about all of us actually figuring out, first of all, that acknowledging there is a problem. And secondly, then, from wherever you are and whoever you represent, what can you do about it? That includes like what you guys are doing, you know, like there's shows now that are focusing on women's health. It's going to take all of us. And today is about the women's voices and actually hearing what they're saying. And then we, as an organization, will come out in the months ahead with what we can do, but we're only one piece of it. It's going to take all of us. And we're hoping we spark a conversation today. But women are loudly at 86% telling, I mean, I don't have to tell you, you're a woman too. It needs change.
So with that said, with all these organizations that need to work together, we can't ignore government as one of them. In terms of funding, that's a big priority, I'm sure, in this sector. Could you tell us what the IWK Foundation's call is for leaders in politics in our government?
To listen, to acknowledge there's a gap, and then let's all work together to make a change, because for 50% of the population, they need that change. And as far as, you know, I'm concerned, women, you know, if we don't have strong, healthy women, I'm not sure what kind of a society we're going to be governing.
When it comes to the priorities, obviously they listed those 6 in healthcare that they want to prioritize. Did the survey point out where those gaps may be when it comes to the care? And forgive me if you already mentioned that, but is it staffing, funding, a combination of everything?
Do you want to do it? So the survey was purposefully set out to hear women's stories, to hear what they were feeling, it didn't go into specifics on the system. This is the first step, I hope, in a journey. I don't know if you want to get more specific about that, but to me, we didn't get into specifics on a system. It was more about, how are you, Jennifer, feeling? What is your experience? And then we collected that together. The interesting thing about this is women were never asked. We never asked women. That's what's unique about this. And so as we move forward, it's got to be, they've given us the blueprint. They've given us what's going on in their lives. Now it's about figuring out, how do we help? From wherever you're sitting in this society, how do you help?
And we purposely didn't ask for solutions. We asked about their experience.
Yeah.
And we are making sure that today is about their experience, not jumping to what can we do about that. There's lots of time to have those discussions, but today is about what those women are feeling and experiencing day to day.
I know a lot of women, when the survey came out, were keen to share what their stories were, but they're also worried that no change will come of it. What can you say to those women who are concerned about action right now?
I can say that from the IWK's Foundation point of view, we are taking this very seriously. Obviously, we're sitting here today. We've done the survey. We are doing other things, and we will be coming out in the months ahead, and they will see how serious we're taking this. But it's not a one organization is going to fix this. It's going to be all of us. And so all I can say personally to every single one of those 27,371 women is that I've heard you. And as long as I'm around, even whether I'm in this job or not, I'll be fighting for this.
I appreciate those answers. Thank you so much. Pass this on to somebody.
Any questions? You can have questions from the floor too.
Okay, we can open up the floor for questions if anyone
Right
has
over
any.
here. Jana.
Jana here from Deloitte. Jennifer, you alluded earlier to all of the system partners that will have to be a part of the solution, and I'm curious if there's any differences across the responses within each of the province that were surprising, just given that, you know, the systems are somewhat different across each of those provinces. So for Nova Scotia, New Brunswick, PEI, Anything that came out that was shocking that we would want those system partners in those provinces to be aware of?
This was the fascinate for me, and I mean, these guys are in research, so but what fascinated me was, regardless of whether it was rural or urban or whatever province, they all answered similarly, and their stories were almost the same. And so my gut's telling me that if we were to do this survey in any other part of Canada, you take in the nuances of the geography, we would probably get the same answers. This is a woman's story. That's what we're talking about now. So it is actually, I expected to have much more differences, but actually there weren't. They're all saying the same thing.
Thank you.
Thank you for the question.
Any other questions?
Are you surprised? It's sobering. It is sobering.
Thank you, everyone. What we are going to do, we're going to put up a QR code on the screen here. You use this QR code and you can find all of the information about the survey itself, some social media toolkits, and anything else that you might need. I'm going to turn it over back to Jennifer now for some closing remarks.
Thanks, Robin. Hopefully I still have my notes here. Where am I here? Okay. I guess I'm just talking ad lib. Ooh, that's dangerous. All I can say is this has been a sobering exercise, but a privilege to do this work. It's part of a whole campaign that you will see us involved in to try and help make this change. And we're open to working with anyone who seriously wants to make change. We will work with you. And to every woman out there that has, filled in this survey, took the time, told us some of their stories were really heartfelt. Thank you for trusting us, and thank you for speaking up. Keep speaking up. You're not alone. And change always comes with the people first. And so let's get together. Let's continue to see what we can do. I offer anyone out there who wants to read this survey, listen to what these women are saying. And then when you know what you know, you can't unknow it. So now what are you going to do about it? We'll do what we can, but we need others to step up and do what they can. So I guess my only sort of final thing is that I heard this lovely line. It's the name of a book, and it's called "You Need to Live Your Life in Crescendo." It means the best is yet to come. So can we all work together so that women can truly feel their future is the best that's yet to come, and not just barely make it through, that they actually thrive? Because can you imagine a world if women were actually thriving? So thank you all, and thank you to those women, and I appreciate your support, and let's go make change. Thank you. And that's a wrap. That's it.